Module 2, the importance of diabetes management and insulin delivery in the long-term care setting. In this module, we will dive deeper into diabetes management in the long-term care setting and study the implications for both the facility and patients, including FTags relating to diabetes management, injection technique recommendations, and diabetes discharge education that you can provide to the patient. Let's start with diabetes in the long-term care setting. It is estimated that over 30 million people are living with diabetes in the United States, which equates to approximately 9.4% of the general population. Looking specifically at the patient population in the long-term care setting, the prevalence of diabetes ranges from 25 to 34%, indicating that nearly 1 in 3 beds is occupied by a patient with diabetes. Furthermore, elderly patients tend to have multiple comorbidities. Thus, it's important to evaluate the overall health of the patient when developing goals and treatment strategies for diabetes management. In addition to increasing the risk of cardiovascular and microvascular complications, diabetes also increases the risk of common geriatric concerns, including cognitive impairment, depression, falls, polypharmacy, persistent pain, and urinary incontinence. Managing patients with diabetes in the long-term care setting can be challenging. Beyond managing their blood glucose, there are also common concerns associated with diabetes, such as pressure ulcers, falls, and medication errors, which can present additional challenges. Better managing your residents with diabetes may also help to reduce these risks as well. As you may know, federal regulations which govern long-term care facilities are known as FTags. There are 3 FTags which are particularly relevant to managing patients with diabetes. They include pressure ulcers, falls, and medication errors. In this section, we'll review FTags relating to those topics in greater detail. Poorly managed diabetes can cause poor circulation and nerve damage over time, resulting in a loss of sensation, feeling, or pain for the patient. As a result, patients with diabetes may not feel the need to shift position as often as necessary, causing constant pressure on their tissue, resulting in pressure ulcers. Federal Nursing Home Regulation F314 specifically addresses pressure ulcers. It states that each resident must receive and the facility must provide the necessary care and services to attain or maintain the highest practical physical, mental, and psychosocial well-being, in accordance with the comprehensive assessment and plan of care. Proper diabetes management can assist in the prevention of pressure ulcers. Diabetes is also associated with an increased risk of falls. This is important as 1/3 of the community-dwelling adults aged 65 years of age and older fall each year. For diabetes residents, this can be due to lower extremity neuropathy or hyperglycemia or hypoglycemia, which can cause dizziness and affects balance. Patients with diabetes have a 67% higher risk of recurrent falls than patients without diabetes. FTags and quality measures exist specifically to address resident falls. FTag 323 states that the facility must ensure that the resident environment remains as free from accident hazards as possible, and that each resident receives adequate supervision and assistance devices to prevent accidents. Ensuring that residents with diabetes are managed properly can help prevent dizziness and lower extremity neuropathy, reducing the risk of falls in this population. The Institute for Safe Medication Practices, or ISMP, classifies insulin as a high alert medication since it has been associated with significant patient harm when misused. Insulin has also been associated with more medication errors than any other type or class of drug. This is important in your facilities, as FTag 332 states that facilities must be free of medication error rates, significant and non-significant, of 5% or greater. FTag 333 states that centers must ensure residents are free of any significant medication errors. A significant medication error is one which causes the resident discomfort or jeopardizes their health and safety. Furthermore, the CMS Medication Administration Observation considers both improper technique used for subcutaneous injection as well as injection sites not rotated as medication errors. As part of medication error prevention, it is vital to recognize the importance of proper injection technique in the management of diabetes. Nurses, practitioners, and patients should be educated about the proper techniques to prevent adverse outcomes, and skills should be assessed annually. Improper injection technique puts patients at risk for intramuscular or IM injections, which can lead to hypoglycemia. By following recent clinical recommendations on injection technique, medication errors associated with insulin delivery can be avoided. In September of 2016, new clinical recommendations on proper insulin injection technique were published in the Mayo Clinic Proceedings. In this section, we'll review two key aspects of the recommendations: needle length for insulin injections, and the rotation of injection sites. Clinical recommendations state the shortest needles are safe, effective, and less painful, and should be considered first-line therapy in all patient categories. Injecting with shorter needles can help reduce the risk of intramuscular or IM injections, which may lead to hypoglycemia. The most commonly used needle length in the long-term care setting is 12.7 millimeters, which does not meet the current recommendations for shorter needle use. It is important to rotate the location where you inject insulin into a patient to ensure the site has time to heal between injections. Make sure a new site is used each time you inject, and that you space subsequent injections at least 1 centimeter from the previous injection. Repeated injections into the same site can cause a complication known as lipohypertrophy, or lipo, which is a hardened, rubbery swelling of tissue that can vary in texture from soft to firm. Areas with lipo may have erratic insulin absorption, so it's important to avoid these lesions on a patient and instead use a healthy injection site. Proper site rotation is critical in preventing lipohypertrophy, or lipo, from forming. The Institute for Safe Medication Practices recommends the one pen, one patient rule. Improper use of insulin pens can increase the risk of bloodborne pathogen exposure between patients. In 2014, an ISMP medication safety alert showed that over 4,200 patients in March and over 3,100 patients in May were potentially exposed to bloodborne pathogens after receiving insulin doses that may have come from an insulin pen used for multiple patients. Heightened attention has been focused on improving 30-day readmission rates, so diabetes discharge education has become critical in ensuring patients are aware of the fundamentals of diabetes self-care and insulin administration. As part of the Skilled Nursing Facility Value-Based Purchasing Program, facilities now receive incentive payments based on a 30-day all-cause readmission measure. Evaluating diabetes discharge processes and patient education is critical to prevent diabetes-related readmissions in this highly prevalent patient population. Facilities should have a discharge plan in place and should work as an interprofessional care team to ensure continuity of care. Patients, family members, and caregivers should be educated on proper insulin injection technique at discharge, which includes use of the shortest needle available to prevent intramuscular or IM injections, lipohypertrophy and the importance of site rotation, and using a new needle for each injection. In summary, careful evaluation of comorbidities and overall health is needed before developing goals and treatment strategies for diabetes management. In the long-term care setting, some common concerns associated with diabetes are pressure ulcers, FTag 314, falls, FTag 323, and medication errors, FTag 332 and 333. It is vital to recognize the importance of proper injection technique in diabetes management, including injecting with the shortest needle and proper site rotation to prevent lipohypertrophy. Now let's work through a self-check quiz together to reinforce some of the key learnings from this module. Which of the following are not concerns associated with diabetes in the long-term care setting? A. Medication errors. B. Falls. C. Pressure ulcers. Or D. All of the above are concerns that are associated with diabetes in the long-term care setting. Great job! The correct answer is D. All of the above are concerns that are associated with diabetes in the long-term care setting. Question 2. Which federal nursing home regulation is associated with pressure ulcers? A. FTag 343, B. FTag 314, C, FTag 323, or D, FTag 305? Correct. Answer B. FTag 314 is associated with pressure ulcers. Question 3. True or false? Injecting with the shortest needle available is recommended for all patient types. True. Clinical recommendations state the shortest needles are safe, effective, and less painful, and should be used as first-line choice in all patient categories. Last question. Number 4. True or false? Lipohypertrophy can be prevented by practicing proper injection site rotation. True. Using a new needle for each injection and practicing proper injection site rotation can prevent lipohypertrophy.